pertussis is a bacterial infection, and it is spread similar to like cold viruses are spread through the aerosol method. But it's a cyclic issue. So every 2 to 3 years, you see pertussis cases go up in number, and that's what we're involved in now. And I know California has a big outbreak, and it seemed to have peaked in the summer months, which is kind of unusual. So you can't blame it on a cold or flu, and so it may be due to the fact that there's actually a new strain of pertussis bacteria out that lacks one of the ingredients called pertactin, which is in the vaccine. So that may be accounting for some of it. Plus, they use an acellular form of the vaccine, which does not immunize people as well as the cellular form. I mean, you don't get the local reaction that you would get with the old one. So that's why I think we're seeing more cases of pertussis. Plus, in California, when I looked at the map, San Diego County had the highest incidence. So is that due to immigration? Is that due to people coming across the border that are not immunized? Could very well be. So it's hard to say.
So if you've been vaccinated for pertussis, how long does the vaccination last? And I heard that it's also in the shot for tetanus.
That's correct. DT. That's different for everybody. One of the problems is that the immunization or our immunologic response waxes and wanes over time. That's why you have the shingles vaccine. That's why you have the others vaccines. My suggestion is that you get this as an adult, probably every 5 years. You think about getting a tetanus and a TD so that you can be protected against diphtheria. Make sure your immune system continues to remember the antibodies, and for young children especially. And the young kids are at more risk for death because of what it does to the airway. When you swell an airway, it doesn't take much on a young infant to close off their airway. Just a little bit of swelling can make it very difficult for them to breathe.
When should a person decide, I'm not going to be able to fight this myself, I need to go to the doctor?
That's different for everybody, but as a rule of thumb, if you're exposed or if you know anybody that has been exposed to diphtheria, they're recommending, because of the current outbreak, that you do get the antibiotic treatment, prophylaxis treatment for that. And that's usually within 21 days of exposure. If you start to develop this strange whooping cough, or you develop a high fever greater than 101.5, if you have shaking chills, if you can't keep up with your fluids, that's when I think I would come to see a local provider.
And we're here at Independent Medical Center right on Calvada, right in the Mountain View parking lot. People want to give you a call. How can they do that?
My number at the office is 775-751-6111.